that question comes quite often because some myth is the more needles you use, the better it is. In the first thinking of it, it might make sense because you think the more needles, the more bleeding, the more result. Keep in mind why a fakir can lay on a nail bed. Because you have so many nails that the pressure is not that the nail stuck through the skin, but it pressures the entire body up. So if you have too many nails on the needling device, then you might press the tissue down without puncturing the tissue. So it's not right that the more needles, the better it is. That's also a very frequent question. If you do cosmetic needling, then you can apply it or also during it, because you can needle it in. In the moment when you do medical needling, so you create bleeding spots, the pressure from the depth to the outside is higher because the blood comes out. So it would be a waste of product to apply them and try to needle it in, because the blood pressure will push it out. Then I would encourage you, clean the face after the needling and then directly apply and use the puncture canals, which are open usually for 8 hours, to apply as frequent as possible the products you want to get into your skin. You mustn't forget you are dealing with bleeding and you are dealing with a wound, even if it's a controlled wound. And you are dealing with a medical instrument. So I would really encourage you, keep this in trained hands. Depends a bit on the law in the countries. Some countries, for example Germany, there are just doctors allowed to do that from a depth more than the basal membrane. In some, it's trained nurses who are allowed to be done. But don't do needling by yourself or in untrained hands. That's what also we've proven in our research, you do not have the risk of hyperpigmentation after needling. Why? Because needling is decreasing the so-called MSH, the melanocyte stimulating hormone, and increasing an anti-inflammatory cytokine, which is interleukin 10. So that means you are able to make visible hyperpigmentation better. Plus, you are, as I explained, you're not removing cells, so you do not interfere with the melanocytes. So no, you don't have the risk of hyperpigmentation. However, you should use sunscreen when you go into the sun. And I always tell my patients, as long as you're red after the needling, for example, 1 to 3 days, maximum 1 or 2 days longer, avoid direct sun bathing, but you have no risk of dyspigmentation. The major important thing is you must avoid crusting. The more intense you do the needling, the more the puncture canals will ooze. So you will see some serum coming out. If you would leave the serum on your skin, the serum will clot in your puncture canals. And if you have clotting, you have the potential risk of crusting. And you have crusting, you will have bacteria underneath, because on our surface of our body, everybody of us has bacteria. So you have this crusting, you have the risk of secondary wound healing, and then you have the risk of scarring. So you must clean the face as long as you are oozing frequently. I think the biggest contraindication are unrealistic expectations. It's as good as needling is, it is super important to explain to your patient the proper indication. So if the patient wants a deep wrinkle to be filled, it's not needling, it's injectables. If the patient wants the frown line to be gone, it's not needling, it's Botox. If the patient wants a lifting effect like a facelift, it's not needling, then it's really the surgery. So the most important thing is to clear the patient the indication, which is skin and the improvement of your skin condition. The only thing what I would add on is I would not needle active inflammation like a severe acne. You can needle mature scars, and you can also needle acne patients with wonderful results, but I would not needle infected areas. If you would have asked me a couple of years ago, I would have said radiofrequency needling is the box of Pandora. It's the best you can do. Why did I think so? And by the way, I was wrong. Why did I think so? I thought needling, by the way, is the best for improving skin condition, and it really is. However, needling has one less effect than any ablative procedures, the skin tightening. And why? Because needling is not producing scars. So the skin tightening is maybe a bit poorer than on ablative procedures. So I thought if you combine radiofrequency, so the radiofrequency pro is the tightening of the skin, with needling you combine both and you will get the best result. So we tried all devices, and the results have been poor. And I thought, why is it like this? Because I thought it's the perfect combination. Think about, because it's not a needling. Needling for me is to produce as many puncture canals, bringing bleeding spots. Radiofrequency needling, the needles do not create bleeding, and you are not going through the surface thousands of times. The needles are just used to get the radiofrequency into the depths of the skin. So you have a radiofrequency needling brings a nice result of the skin tightening, but not the benefit of needling by itself. Yes, you can. So you're not curing the illness, but you make it less visible. And the reason therefore is I would call needling like a skin normalizer. So you, as I said, you increase the thickness of the epidermis, you have new blood supply, and you're reducing the inflammation process. So rosacea patients are benefiting after needling. I think that the biggest difference is the scar-free healing. So any thermal procedures, doesn't matter if it's radiofrequency, doesn't matter if it's Fraxel laser, doesn't matter if it's dermabrasion, etc. They all work with heat or thermal damage. So the shockwave protein, and that leads to a controlled scarring. Needling works the complete other way around. Needling is a regenerative process which works on the base of regeneration due to body-owned growth factors and on the base of scar-free healing. Yes, we do. So, and I think that is also the demand of the patients or of the time where we are living in. People like to combine. People like to combine botulinum toxin with fillers. People like to combine a facial with needling or even PRP or any kind of body-owned stimulation like polynucleotides, etc. We do that, and it's very safe. However, when you combine it, you must be sure that the thing which you add is as safe as needling. Because what I do not want is that you create any side effects, for example, using local externals with perfume, for example, which bring infections, and then the needling is blamed for that. So we love to combine it, but be sure with what you combine it.